The Health Ministry abandoned procurement of medical equipment through public-private partnership initiatives on account it would have been too expensive. Documents from the Afia House indicating leasing would have cost the Ministry of Health a lot more in maintenance of the equipment in case of a breakdown, and outdated technology would cripple operations as the equipment would be rendered obsolete with no replacement under a leasing scheme. All these benefits that came with the managed equipment services, saving the country, get this, some 29 billion shillings. Let's get more from our very own Sam Ogina.
It is a controversial report lying before the Senate. The Senate committee report on the managed medical equipment services, indicting the then Afia House officials of undertaking what it described as a criminal enterprise shrouded in opaque procurement processes. But documents from the Ministry of Health now indicates Afia House abandoned the public-private partnership initiative for the managed medical equipment services on account of financial prudence. The then Cabinet Secretary CS Macharia, in his defense to the Senate committee, indicated MES included the supply, maintenance, upgrades, replacement and financing of the medical equipment. These, as opposed to leasing that will have meant replacement of spare parts to the equipment, would be incurred by the procuring entity, in this case the Ministry of Health, and in the case of outdated technology in a leasing scheme, there is no replacement. While the project was initially capped at 43.5 billion shillings, the Senate claims the exact amount of the contracts remains unknown after mandarins at Afia House changed the scope of procuring the equipment. Kenya signed contracts with 5 private firms in 2015 to lease specialized equipment like CT scanners to the country's 47 county governments. But the Senate report described the deal as a criminal enterprise that flooded hospitals with overpriced, unnecessary equipment because there was no one to operate the equipment or problems replenishing supplies needed to make them function. To counter this narrative, the Health Ministry indicates a feasibility study conducted in 2014 demonstrated 41 counties did not have HDU equipment, 39 counties lacked ICU equipment, 29 counties did not have equipment for maternity theatre, and 28 counties missed critical casualty services equipment. Despite the Senate report calling for the EACC and the DCI to investigate individuals involved in the executing of these contracts and those found culpable, charged and barred from holding public office, the documents seen by Citizen TV indicates the contracts were given a clean bill of health by the Attorney General's office. The AG's office authorizing Minister of Health Principal Secretary to undertake the contracts with the 5 companies supplying the equipment. The AG's office equally granting Afia House the corporate power to enter into and perform obligations set out in the managed equipment services contracts. President Uhuru Kenyatta launched the 43.5 billion shillings medical equipment leasing scheme at State House in 2015. To date, the Health Ministry estimates that the county governments are earning up to 3 billion shillings from these facilities from refunds from NHIF. Documents in our possessions also show that all county governments signed an MOU with the Ministry of Health to receive the equipment apart from Bomet County. Sam Ogina, Citizen TV, Nairobi.